Tonight, Jamaica recorded 5 additional COVID-19 deaths yesterday, while 290 newly confirmed cases takes the total of cases now to 18,527. Health and Wellness Minister announces that there has been a significant increase in COVID-19 patient hospitalizations in the country.
There's a relationship between positives and hospitalization. Yesterday, Wednesday, saw our highest hospitalization with some 198 COVID-19 positive cases or patients in hospital.
Still tonight, 72 hospital beds to be added to the national count, while the Ministry of Health and Wellness is to commission 2 new facilities to deal with the spike in COVID-19 cases.
So I really think that this has been a good example of collaboration for an important cause, and hopefully it sets a benchmark for others to follow.
And MP for Eastern Portland, Anne-Marie Vaz, will be financing all monthly premiums for a period of 1 year for 50 farmers and fisherfolk in the constituency under the new Sagicor Agri-Care program. Good evening. The Ministry of Health and Wellness is reporting that Jamaica recorded 5 additional COVID-19 deaths yesterday, February 11. The deceased, all from Kingston and St. Andrew, are comprised of 4 females aged 52, 60, 80, and 82 years respectively, as well as a 40-year-old male. Now, this takes the overall coronavirus death toll on the island to 368. There were, however, 2 other deaths involving COVID-19 patients under investigation, while another death has been classified as coincidental. In the meantime, the country yesterday recorded 290 new COVID-19 cases from 1,497 samples and 48 recoveries. The 290 newly confirmed COVID-19 cases takes the total of cases on record for the island to 18,527, while the 48 recoveries make it 12,504 persons that have now recovered from the virus in Jamaica. Now, of the newly confirmed cases, 152 are males and 137 are females, ranging in age from 21 days to 102 years, while the gender in 1 case is awaiting confirmation. The cases were recorded in Kingston and St. Andrew with 64 cases, St. Catherine recorded 44 cases, St. James 42 cases, Trelawney 22, Hanover recorded 20 cases, St. Thomas recorded 18 cases, Manchester 17 cases, Clarendon 16, St. Mary 14 cases, St. Anne and St. Elizabeth recorded 10 cases each, Portland recorded 8 cases, and Westmoreland recorded 5 cases. There are 30 moderately ill patients and 23 critically ill patients among the 5,465 active cases. In the meantime, Minister of Health and Wellness Dr. Christopher Tufton announced yesterday that there has been a significant increase in persons testing positive for COVID-19 being hospitalized, as there has been a rapid increase in cases over the last 2 weeks.
As the new cases are confirmed, we have been seeing an increase in hospitalization. And there's a relationship between positives and hospitalization, and that is borne out in the data. Wednesday, for example, yesterday, Wednesday, saw our highest hospitalization with some 198 COVID-19 positive cases or patients in hospital, with a minimum so far this week of 159. Now, this is very, very important to note, because hospitalization means is an indication of the seriousness of the illness or the impact of COVID on those patients, and it also means an increased risk of the most severe outcome, of course, that would be death. And this is of concern to the ministry and to the government, as it should be to all Jamaicans.
Dr. Tufton further pointed out that 309 of the total 362 beds that were designated for COVID-19 patients are occupied.
Currently, some 309 of the approximately 362 COVID-19 beds across the island are occupied, making the occupancy level for COVID-19 beds the highest it has been to date at some 85.4%. So occupancy of our COVID wards, these are wards that we constructed in the early days of COVID back in February, March and beyond in each hospital across the country, with special features for separating them from the general populace, the provisions for additional oxygen or the ventilators, and again to protect both those who are in those wards and those who are within the institution, who are outside of those wards because of the highly contagious nature of the virus. So at 85.4% occupancy rate, this for us is a major warning signal. As a consequence, the measures announced by the Honourable Prime Minister in Parliament on Tuesday as part of the messaging to pull back and to get greater compliance and hopefully to cauterize the spread.
In related news tonight, 72 additional hospital beds are to be added to the national count as the Ministry of Health and Wellness is to commission 2 new facilities into service to deal with the ongoing spike in COVID-19 positive cases on the island. According to Portfolio Minister Dr. Christopher Tufton, the officials at the ministry anticipated that more beds would eventually be needed in the system. As such, provisions were made as ground was broken at the St. Joseph's Hospital in Kingston, as well as the Falmouth Hospital in Trelawney some 5 weeks ago.
Now, luckily, 5 months ago, we broke ground for those 2 facilities. I want to commend the ministry, the permanent secretary in this case, working with the regions and indeed the contractors who were deployed and the project management team, because within that 5-month period, they were able to build out 2 facilities. I visited St. Joseph's today, and that facility is a real first-class facility. I mean, I was very impressed, and all accounts, including MP Julian Robinson, the councillor, the mayor, of course, our team, because we now have that 36-bed facility that would add to the bed count for COVID patients, equipped with all the necessary infrastructure for oxygen, ventilators, all the other stuff. In the nick of time, we can say that we have added, or will add in a few days, some 72 beds, 2 locations, one in Kingston, the other in Western Jamaica, as we had anticipated would be like a likely possibility. And these are now going to be equipped with the necessary infrastructure to deal with any overflow.
Now, Dr. Tufton stated at the weekly COVID-19 press briefing yesterday that the facility at St. Joseph's Hospital was visited and the work has been completed. The hospital will now be able to provide an additional 36 beds to complement the 362 national COVID-19 beds that the government prepared before the start of the pandemic. Meanwhile, today, the ministry's team visited the new facility at Falmouth, which Dr. Tufton says is almost completed and should be ready within the next few days.
So I want to use the opportunity to thank the team, the region that has coordinated this, the project team back in Kingston, the contractors, and of course this hospital, management board and others, the parish council who give the approvals for really working together in a coordinated way. I can say with confidence that this project has been delivered as a good quality project within time, despite nearly a month of rain, within budget that was scoped for, and it's a good, nice facility, as you can see. So I really think that this has been a good example of collaboration for an important cause, and hopefully it sets a benchmark for others to follow. where we have always had complaints about waste and time overruns and cost overruns and so on. So I want to commend everyone who has been part of that process.
The hospital's senior medical officer, Dr. Leighton Perrins, says this is a positive addition to the hospital and by extension the Western region in order to care for COVID-19 patients as they are at full capacity at the moment.
We welcome the addition of the field hospital. Hopefully, as the Minister of Health said, we'll get it handed over to us in the near future, which would be a positive thing for Falmouth Hospital in general, but also for the parish of Trelawney and the Western region. So we'll be able to better care for patients who are infected with COVID-19. So we're looking forward to the future, and hopefully soon, to get things, going, because we are at full capacity at the moment, and we need the space.
Mayor of Falmouth, Councillor Colin Gager, in speaking with our news team, pointed out that sanitization work is being done at the Falmouth Infirmary to help ensure the safety of vulnerable residents in the parish.
We are making sure that we do a whole testing of everybody, because we do believe that it came from the outside and came inside. So we are doing everything to see what we can do about that. We are also sanitizing. Yesterday and today, we are doing deep sanitizing work, making sure we fumigate the whole place and make sure that we have everything up to par. It is of importance that we move swiftly to protect the residents who are at the infirmary. So it isn't lack of staffing or anything. We just don't know how it was transported inside, but it is there. So what we are trying to do is make sure that we can cauterize it early. One patient is at the hospital, the other 5 is in isolation as we speak.
The mayor further pointed out that persons are not taking the protocols seriously, and it is of great concern to him.
I am concerned about COVID in Trelawney because I believe the cases that we are having is just too much. We are having activities all about, you will see people having activities. Our people will not take wearing of masks seriously, and social distancing, and sanitizing. So when I'm going home in the days, you will pass all sort of little parties on the roadside. And that, I think, is what is contributing to the spread of COVID. Unless we as a people take COVID seriously, we will not be able to bring it under control. The government is doing what they can, but we must take responsibility of ourselves and do our part in protecting those who are most vulnerable in the community. We have to do that.
Still tonight, Health and Wellness Minister Dr. Christopher Tufton, during the ministry's press briefing yesterday, pointed out that over 600 health team members are being trained to administer the COVID-19 vaccination. He assured the public that the COVID-19 vaccines to be administered to Jamaicans are certified by proven standards.
The technical team continues its internal training and sensitization of the healthcare team that will administer the vaccines once the vaccines get here. Some 662 team members, a majority of whom are public health nurses, are now in training and will be ready to carry out vaccinations. Our number one priority, of course, it remains the safety of our people, and the government, through the ministry, will continue to seek out all avenues to the best health outcome for every citizen. But at the end of it all, our selection of a vaccine has to follow a protocol. And I want to reassure the public that we will not embrace or endorse any vaccines that falls out of the protocol of going through the expert assessment that the World Health Organization traditionally subjects a vaccine to before it is certified as safe. We are in touch. We have persons who are involved. Professor Figueroa, who was here last week with us. And that's the basis on which we will bring vaccines in.
Meanwhile, Director of Family Services in the ministry, Dr. Melody Ennis, said the AstraZeneca vaccine is on the WHO's emergency use list, and from all the vigorous tests, it has been proven to be safe for persons 18 years and older.
The interim guidelines that have been produced by PAHO WHO under the guidance of the Strategic Advisory Group. And first go is that the AstraZeneca vaccine has been placed on the WHO's emergency use list, and therefore this vaccine can be administered to persons 18 years and above. 2 doses is what will be required. This will be given in the upper arm, and it will be administered 8 weeks apart. So you'll get 1 dose and you'll get the second dose after about 8 weeks. Now, the concern for most persons is about older persons. The review has found that the immune response that is induced by this vaccine in older persons is excellent. The safety profile is good, and therefore the recommendation from this group is that the vaccine is safe and efficacious and should be used in persons over 65 years. We've also been concerned about comorbidities, and these diseases such as hypertension, diabetes, or cardiovascular illnesses, respiratory illnesses, and obesity were studied in the trials, and the results indicate that it is safe for the vaccine to be had by these persons, and therefore the recommendation is that these persons who we know fare the worst with the illness will be vaccinated with the AstraZeneca.
Acting Director of Nursing at the Falmouth Public General Hospital in Trelawney, Pauline Palmer, says she will be taking the COVID-19 vaccine as a means of protecting herself and everyone around her.
Yes, I will be taking the vaccine. Taking the vaccine to protect myself and to protect my family, to protect the patients that I serve and my co-workers. So it's very important, as Dr. Tufton says, vaccine is a very important part of Jamaica's history. From we were small, we have been taking vaccines, and I think the COVID-19 vaccine will lessen the burden on the country itself and on the patients in the hospital and nationwide.
Dr. Tufton says the country has benefited from vaccination and is fully on board with having the COVID-19 vaccine go through a process to ensure safety for the general population.
Jamaica has a strong history with immunization. Most of us have that blotch on our arm if we're old enough. What you get in high school, in primary school, and it normally turns out into a little sore until it gets better. I have one, see mine right here. See it right here, sir, right? And our human development index, where people live till 76 in the case of women, 74 in terms of men, is largely influenced by our immunization program. And therefore, we are fully, as a country, across administrations, PNP, JLP, bought into vaccination and immunization. And we have benefited from that. The world indeed has benefited from it. So we're fully on board with the principle, and we know what it will do for the COVID response. But at the same time, we have to ensure that the vaccines that we endorse and support, it goes through a process. And that process, simply put, is a process of trials, a process of validation, of data analysis on the people that it is tried on, and so on. And that process resides substantially in the World Health Organization.
Still tonight, in light of the ongoing COVID-19 pandemic, Effective today, the Bank of Jamaica temporarily suspended teller services until further advised. In this regard, BOJ says they recommend that for the exchange of foreign currencies and other banking services, the public should rely on their commercial banks and/or other deposit-taking entities. As it relates to coin exchange, the public should continue to utilize the services of Grace Kennedy Payment Services at their locations island-wide. The bank also advised that the critical systems that support transactions in the financial markets will continue to operate. The Bank of Jamaica regrets any inconvenience that these temporary changes may cause and is encouraging all customers and stakeholders to continue to take the necessary steps to remain safe. Now we will continue to monitor the situation and provide updates as necessary. Continuing with the news tonight, the man who allegedly drove the getaway car in the fatal shooting of 51-year-old Andrea Garwood is expected to plead guilty when he returns to the Home Circuit Court on February 18. Leon Hines, who appeared before the court this morning, said that he was in the process of entering into an arrangement with the prosecution and that documents were prepared for him to sign. However, the prosecutor informed the court that the documents will have to be amended in light of a new statement that has been submitted. Consequently, the 23-year-old storekeeper of Rose Heights, Montego Bay, St. James was remanded. He is charged with murder, illegal possession of firearm, accessory before the fact, accessory after the fact, conspiracy to commit murder, and misprision of felony. Hines, who was arrested in Kingston, appeared before Justice Lorna Shelley Williams via voluntary bill of indictment. He is charged along with 29-year-old Javan Garwood, otherwise called Janoy, who is charged with murder and conspiracy to commit murder, and Dwight Bingham, who is charged with murder and illegal possession of firearm. Mrs. Lowe Garwood was among those worshipping at the Agape Christian Fellowship Church in Falmouth in January, when a man entered the building and sat on the bench behind her. Now, during the praise and worship segment, the man reportedly pulled a handgun and fired multiple shots, hitting Mrs. Lowe Garwood to her upper body before running from the building and making his escape in a white Toyota Allion motor car. Mrs. Lowe Garwood was rushed to the Falmouth Hospital, where she was pronounced dead. In other news, following weeks of gang conflict within the Denham Town Police District, 18 of 22 persons who were listed as persons of interest have turned themselves in to the Kingston Western Police. This disclosure was made by Police Commissioner Major General Anthony Anderson yesterday during a Crime Monitoring and Oversight Committee virtual press conference. The names of those in police custody were not released by Commissioner Anderson. He explained that those in custody will be questioned as the police continue to work on cases within the division. Additionally, he shared that 4 other men are being sought in relation to the violence in the division. On February 4, the police issued a statement urging the 22 individuals to turn themselves into the Denham Town Police by 6 p.m. the following day. The persons were linked to gang conflicts within the Denham Town Police District that had allegedly extended to several other communities in the police division. And those are some of the stories making news. We will return with more stories making news as a program implemented by the National Solid Waste Management Authority over 7 years ago to help solve Jamaica's plastic waste problem is gaining traction and building environmental awareness in communities, as residents in the Irwin community in St. James earlier today participated in the program. And the Member of Parliament for East Portland, the Jamaica Labour Party's Anne-Marie Vaz, will be financing all monthly premiums for a period of 1 year for 50 farmers and fisherfolk in the Portland Eastern constituency under the new Sagicor Agri-Care program. But first, we'll take a break and then it's over to Christopher Scott with the very latest in sports.